I'm Peter McCarville for NCD News. Yes, Britain has free healthcare, if you can get it. We've researched many articles on the unease with which many Brits view the National Health Service. To re-summarise, the NHS is not a free health provider, rather it rations care. You can certainly sign up for free treatment, but your actual waiting period and level of care will depend on the resources the NHS has on hand at the moment to ration to you. This is why there are so many stories about people literally dying while waiting for NHS help. This is also true in the area of dental care. Since dental care is usually not life-threatening, you may have to wait even longer for an NHS dentist and ultimately receive a level of care that you are not satisfied with anyway. HSF's own research confirms that an astounding 50% of Brits have not seen a dentist for 2 years or more. This is all very strange because there is, in theory, a perfect healthcare system here in Britain. The National Health Service should provide comprehensive care for all residents of the UK, providing particular assistance to low-income individuals who otherwise might not be able to afford private healthcare. Those who have a bit more money can opt to purchase such private care. Prime Minister Gordon Brown has repeatedly referred to the NHS as the best healthcare system in the world. The strong political support for the NHS is what has continually beaten back challenges to it over the decades. Just recently, we reviewed how Labour, Tories and the Lib Dems all blasted a report by think tank Reform, which suggested that Britain move more towards an efficient private healthcare system through vouchers. All three parties confirmed their support for the NHS instead. Of course, that voucher top-up scheme now seems to be going ahead, but we'll detail that U-turn some other time. Is our healthcare system really that great? The Reform report aside, numerous pieces of research suggest that the NHS is not providing the sort of truly comprehensive care it says it does. The NHS even goes out of its way to stifle attempts to get well by combining private treatment with NHS treatment. The result is a system that satisfies hardly anybody. More recent evidence of this was found in research released by Engage Mutual Assurance, which found that 60% of Britons were unable to fund healthcare they needed. In a list of healthcare services Brits cannot afford, the results were dental checkups at 43%, spectacles at 43% as well, vitamins at 23%, medical prescriptions at 20%, and eye checkups at 16%. Again, healthcare in Britain is not free and fully comprehensive, it's rationed. That means in reality, limited cover, waiting periods and service so bad it has given Britain the highest cancer mortality rate in the EU. Michael Moore's vision of the UK health system is the same as the ideology the politicians throw at us. We'd like to see Mr. Moore's sequel after living here for a few years and experiencing how the theoretically excellent NHS plan is actually being delivered. I'm Peter McCarville for NCD News. Cheers.